I think this fellowship offers people the opportunity to do almost a traveling fellowship within a fellowship. You have a variety of different surgeons that practice in a variety of different ways, and you have the ability to not only observe but participate in these various ways to treat the same problem.
The mentorship model, I think, is a very effective model. So for 1 month, you will be with an attending. You get a chance to really kind of get into their brain a little bit and see what they do and how they do it. And then you move on to the next person and start that whole process again.
It mirrors real life. You can see what it takes to juggle the challenges of a medical practice and an academic practice.
What we do from the beginning is, in a very structured way, gradually step back and allow the fellow to take more and more control and have more and more autonomy in the case, so that by the end of the year, they're really ready.
The fellowship faculty prioritize education and didactics. We have recently revamped the entire educational curriculum.
Have cadaver sessions with the fellows, which I think are very important for simulation activities. We have lectures that we give to them. We have a case presentation conference we do with them.
We also have a business curriculum where we go through some journal articles focusing on practice management, and there's also a series of practice management lectures that the fellows get.
As a fellow, when you come here, you're primarily here at CMC Main. So we operate at the main OR, and then we operate at one-day surgery, which are both basically in this hospital. And then very occasionally, we will go to another hospital, Mercy Hospital, which is about 1.5 miles away, and do cases over there. We have a large breadth of cases here. We have a lot of volume that comes through our trauma center, and we see the worst of everything. And so we're a tertiary/quaternary referral center. We have no shortage of volume, that's for sure.
The fellows are on call 1 out of every 3 weekends, and they work both with a combination of orthopedic trauma attendings and also the non-trauma specialty attendings. And so the 2 weekends that they're off, they get time to spend with their families and do whatever recreation activities they want. There's certainly plenty of that to do around Charlotte.
It really is a family-friendly place. The food scene is good, the entertainment scene is good, you're safe here, things are affordable here, travel is very, very easy.
It's a young city. There are a lot of younger professionals that live and work here. The weather is nice. There are mountains 2 or 3 hours away. The beach is 2 or 3 hours away. We have mountain biking trails. There's just always something going on in Charlotte. It's just a very lively city.
I think our fellows leave with a good feeling about their experience here. We try to treat them as colleagues, but we do make a strong commitment to trying to provide some education for them in that process as well. So I think everybody leaves happy and feeling like they can come back and can communicate with us and call us on the phone when they have questions or problems after they get in their practice.
I don't think you realize in fellowship how prepared you will be at the end of the day. And I think that they did a very good job at preparing for, teaching because you're involved with the residents, preparing for the big cases that come through the door because they do. With all the teaching and everything that goes on throughout the year, they give you a good ability to work through the problems that may come through your door.
The amount of volume of trauma that I think that we saw during that year as a whole was a memorable experience. And then honestly, just working with each individual attending, not only do they have a long storied experience, but you are with them on a daily basis, really kind of understanding what it is to be a trauma surgeon, talking to the patients, seeing them in the office with the attending, planning the cases with them when they're planning the cases. So you really are living the life of a trauma surgeon, and the mentorship that you get in that sort of modality, I think, is really far superior than what you'll see elsewhere in the country.
CMC is the premier academic orthopedic trauma fellowship in the country. It was billed that way from the very beginning. When you first went on your interview, the expectation is that as a CMC fellow, you're going to go on to being an academic orthopedic traumatologist.
When we're looking at what fellows will do well here, it's fellows who are motivated to learn throughout the year, fellows who want to see as many cases as they can do and really want to get involved in each case individually and also in the trauma service.
But we're looking for a personality match. We're looking for somebody who's motivated and wants to learn, looking for somebody who's curious and inquisitive, somebody who has an open mind and willing to absorb new things. We want somebody who wants to do something special when they're done.